Hey guys, it is time to finish up the chapter by talking about blood pressure, height, and weight. Blood pressure, you guys have probably all had your blood pressure taken at some time and may not have even realized what they were doing when they were taking your blood pressure. But basically what they're doing is measuring how much pressure is in your arteries or pressing against your arteries. And so when we take blood pressure, we're actually taking two measurements. The first measurement is we're seeing how much pressure is going against those artery walls when your heart is at work. In other words, when your heart is beating or contracting or squeezing out the blood. And then the second measurement is called the diastolic. That is the bottom number. So when we report our blood pressure is reported as a fraction, like 120/80. The bottom of that is the diastolic. That is how much pressure is on the artery walls when your heart is at rest, or when it is filling with blood. The tool that we use to do this is called the Sphygmomanometer. And when you look at the Sphygmomanometer, there are all even numbers. There are no measurements that you can get when you take it manually with a stethoscope and get an odd number. Everything is even numbers. And there's a picture in your handouts of what a blood pressure cuff looks like and what the manometer looks like. When I get back, I will make sure that you see that and you can check it out. But some of the things that would affect someone's blood pressure include movement and cooperation of the patient, noise and distractions, because you're listening with the stethoscope. If somebody's being really loud or their TV is turned up very loud, it can be very hard to hear sometimes. Sometimes if somebody gets anxious or excited or they're upset, their blood pressure can go up. Certain diseases and traumas can affect somebody's blood pressure. Like if they're losing a lot of blood, their blood pressure is going to go down because there's not as much pressure in the arteries. If the equipment doesn't work, and so forth. And another thing that is going to affect the measurement is the size of the blood pressure cuff. If you try to put on a small cuff on a very large person, then the blood pressure measurement is going to be high. And the opposite is true. If you try to put a very big cuff on a small person, then the blood pressure is going to be extremely low. So you have to make sure that you're using the right equipment and make sure the patient's in a calm state if at all possible. As far as abnormal measurements go, if somebody's blood pressure is high, we say that they have hypertension. In order for it to be said that the person has hypertension, they have to have at least 3 measurements of high blood pressure on different occasions. Sometimes high blood pressure is referred to as the silent killer, and that is because the symptoms of high blood pressure, a lot of times people write them off as something else. So things like headaches, fatigue, and weakness, and visual disturbances. They just say, oh, I must be really tired, or I didn't get a lot of sleep, or things like that. And then they don't go get checked or examined by the doctor. And then what ends up happening is there's a complication that comes from high blood pressure, either a stroke or something like that. And then the person passes away. So that's why it's called silent killer, because people sometimes don't know that they have it. When we're measuring blood pressure, if we get an abnormal reading, the way that you handle that is that you let the person's arm rest for about a minute or two and then retake it in the other arm. Some people, a lot of people have high blood pressure, but there are also people that have low blood pressure, and that is called hypotension. So don't mix hyper and hypo up. Hypo is low blood pressure. When we measure it in millimeters of mercury, which is mmHg. You can do it manually, which is when they put the cup on and use a stethoscope. They can also be measured electronically. Some of you may have had that done where they put it on your arm, they push a button, and it pumps up automatically and gives you a reading digitally. Both of these are considered to be non-invasive forms of blood pressure measurement. But there are units in the hospital that do what they call invasive procedures, which is basically they put some kind of monitoring device inside the body, either in the arm or in the brain, and they can measure these the measurements and see how much pressure is built up on the inside of those arteries in those places. So it's very highly and technical thing. So you're only going to see that in places like the intensive care or critical care, emergency room, and places like that. Some of the things that can affect blood pressure include emotions. We talked about anxiety and being anxious and that kind of thing. So think about it. If you're out in the field and Halloween and somebody at a fright night or that kind of thing, and somebody jumps out at you, your blood pressure is going to go up. If you're sleeping and you're laying down and you're just real nice and relaxed, then your blood pressure is going to be a little bit on the lower side. Medications can affect it. Either way, some medicines put it up, some put it down. Diet, if you eat a lot of salt, for instance, it can actually raise your blood pressure. Your weight, the amount of stress, and the position you're in when they're measuring it. Your blood pressure is at its lowest when you're lying down and at its highest when you're standing. There's also people who have a condition called orthostatic hypotension. As they stand up, their blood pressure falls too much, and they get dizzy or lightheaded when they stand too quickly. And it's normal for all people to have that every once in a while as well. So that's it for blood pressure. So the last thing that we need to talk about is height and weights. These are technically not vital signs, but they are a lot of times measured at the same time and that kind of thing. So they are included in this chapter as well. Basically, when you're measuring weights in a hospital type setting, it may be on a daily basis. Believe it or not, because some people's weight can change on the daily basis based on their diet or their medicine, or their medicines may need adjusted based on their weight. So a couple things as far as weighing somebody to keep in mind is that they should be weighed on the same scale at the same time of day with the same clothes on. So you might ask, like, why? What's the big deal? So every once in a while, scales are calibrated a little differently, so that's why it's important to be on the same scale. The same time of day is important to make sure it's consistent. If you weigh them one day before breakfast and the next day after lunch, there's going to be a difference in weight due to the food that is in this person's stomach, and the same clothing on. So if one day I weigh them with only a patient gown on and the next day they have jeans, a sweatshirt, and shoes on, there's going to be a big difference in weight. And so if we're adjusting medicines and things like that, we have to be pretty accurate with the weight. So you have to do things consistently. Anyone 2 and over, we use a standing scale and this is what you're probably most familiar with, where you go and you stand and they weigh and measure you. If you're 2 and under, we actually have this kind of scale that you sit on, and we weigh you naked. So if you're ever in a doctor's office and you see them carrying a naked baby around, chances are that's probably for it to be weighed, that kind of thing. Now, in the medical field, all of our weights, or many of our medicines are based on somebody's weight. And to calculate the dosages and that kind of thing, we need the weights in kilograms, and so we have to be able to convert between kilograms and pounds. And to do that, we need to remember that in 1 pound there is 2.2 kilograms. So to find the weight of somebody in kilograms, if we have their weight in pounds, is to divide their weight in pounds by 2.2. So I gave you an example there in your packet of if somebody weighs 150 pounds, you divide 150 by 2.2 and you end up getting 68 kilograms. So believe it or not, that is the end of chapter 10. So the next day we're together, we will review and we will go from there. If you have any questions, write them down and I'll make sure I answer them when I get back. Otherwise, I'll see you then. Bye, guys.